Previous episodes, we talked about emergency room and urgent care services. And most of you may not know, but there's also another service that's available for you and your family. That is called telemedicine. Telemedicine is when you have the ability to contact a healthcare professional, typically an American board-certified doctor, either by telephone or video or through the internet. That is when you have the ability to contact that type of individual. Typically, when you go to a telemedicine site, they offer you several options to what you can choose for the type of service that you want. It can either be a routine type of service, it can be a video service, or it can be a VIP top priority service. And it all depends upon your severity of service that you require. And so typically, how you would do this is wherever you would be in a town, or you would use Google and say, Google telemedicine near me, or that Google Chicago near me. But more importantly, the questions come up, when do I use telemedicine? When is that available for me? When should I use that? Emergency room, immediate care, urgent care services. When would that be used? Typically, it would be used when you feel heart attack symptoms, you have a laceration, a cut, a sprain, a strain. Those are under certain conditions. Those are under those conditions of when you would use those services. However, when would I use telemedicine? Telemedicine is used for non-emergent services, and what we find would be for upper respiratory tract infection like bronchitis, UTIs, sinusitis, the flu, the cough. You would use it for medication refills. One of the things, though, to be aware of, they do non-narcotic. So you won't see, if you need a narcotic refill, that won't happen. Most telemedicine sites have a Q&A section. So when you're looking for a particular ailment or condition that you have, just type it in and it will give you the answer that you're looking for. So they try to make it easy for you to find that condition if they can help you. Would use a telemedicine service a couple different ways. Is A, when I am out of town. I don't have my PCP available and I need medication. That's one. Number two, your doctor may be on vacation and you may need that medication refill. Or three, your doctor just isn't available, can't see you for a couple weeks and I need it. What do I do? Those are typically good indicators of when I would use a telemedicine service. But the coolest thing is that maybe you might remember this or have experienced this yourself, is when you're in an emergency room or in a doctor's office, it's crowded, everybody's sick. And guess what's going around? Germs. Here you are, you're by yourself in your home or in your hotel room, on the computer, on the phone, talking to the doctor, coughing. It's just you. You don't have to worry about anybody else. It's just you. So that's where you find another great benefit of using a telemedicine service. Let's talk about the financial aspects of telemedicine. But first, let me make it clear, telemedicine does not replace your primary care physician or the emergency room. The other thing about telemedicine, no insurance accepted. They accept cash, credit cards. The other nice thing about telemedicine is just a one-time fee. You just pay a one-time fee, and typically that fee is $35 to $75 in that range. No reporting to the insurance company and no pre-existing conditions. You don't have to worry about that. So, one last thing, I can't stress it enough, telemedicine does not replace your primary care physician or the emergency room. The doctor probably has written a medical prescription for you for medication. The only thing that you have to do now is just go to your local pharmacy and pick up the prescriptions. So hooray, you've had a successful telemedicine consultation. However, if you have no insurance or don't have an insurance card, there are discount prescription cards that are available. Continue to follow us on our next episode when we discuss how to save money on your prescriptions. Ready to get started? Cut through the red tape? Great! Let's get started. To subscribe to this video series, click on the link below.